Health Literacy 101. My name is Tanisha. I am joined here with Teresa. How are you doing this evening, Teresa?
Well, I'm doing great now. I'm back in the program, so I am ready.
All right, so we have a few words about Libraries Build Communities, our partner. There we go, Libraries Build Communities. Excellent. So we were very happy to get a grant for this collaboration. So we are doing programs in collaboration with USF, and this is one of the Libraries Build Community programs. So if you'd like to see any other Libraries Build Communities, you can just search that hashtag on our calendar. You'll be able to see what else we are doing. So I am going to go ahead and get out the way so that Teresa can present you all of the wonderful information she has prepared. Teresa, go ahead and take it away.
Excellent. Thank you all for joining us this evening. So first and foremost, if this is your first time in one of our virtual programs, we always do a book shout out. So today's book shout out is called How Not to Die. I really enjoyed the title, and it actually has some fantastic information in there just about how your health is based upon the foods that you eat. And so this kind of talks about different ways to kind of improve your health after you get some kind of diagnosis or a test result that's maybe unfavorable. You can actually kind of adjust your eating habits to your benefit. And I know this is something that most of us know, but this is written by an actual doctor and gives us kind of more tangible evidence of that and how to incorporate that into our diets. But you can find this book in our catalog, hcplc.org/books. And you can also find it on Overdrive. And if you've downloaded the Libby app, because Libby is the Overdrive app, you can find it on Libby as well. All right, so you guys have joined us for Health Literacy 101. Let's talk about health literacy, and I will go ahead and stop sharing my camera so you guys can see the full screen. So why health literacy? Health literacy means that we're taking preventative maintenance for our health, right? Because preventative maintenance is better than the alternative. It's like if you have a car and you never get the oil changed, and now you've got a blown head gasket. So your blown head gasket is more expensive than getting your oil changed, right? So preventative maintenance, eating the right foods, making sure you're, keeping your blood flowing, remaining active and healthy is better than not doing so. Because when you don't do so, you end up contracting some diseases that are actually preventative. Knowing about your health will assist you in making informed decisions, right? So if you know that you have high cholesterol, you can start doing research on the things that will maybe help your cholesterol to go down. Health literate community members can lead to a healthier society. And we all want a healthier society, right? So we all want to live longer and to play with our kids, our grandkids, great grandkids, God willing. So if you're healthy, you're able to do that. And if you're health literate, you can maybe help spread information to your family members, close friends, and help them get healthier as well. And we all want that. So let's talk about finding reliable information. Again, you get a health diagnosis, high cholesterol. If we decide to hop on Google, one thing we have to keep in mind is let's be specific in our search, right? So let's search maybe high cholesterol treatments other than just high cholesterol in general. Or, if we are on the verge of, getting, or if we have the early stages of some kind of cancer, let's search for colon cancer as opposed to just cancer, okay? Secondly, let's make sure it's coming from a reputable source. So there are lots of websites out there on the World Wide Web. So what we want to do is we want to make sure that the website that we're looking at, that we're getting our information from, is reliable. So we're looking at who is the author, and health information changes rapidly. So we also want to make sure that it is current. So we're looking at when was the page last updated or the information last updated as well. One of the things we want to stay away from are wikis. You guys know Wiki. You've been on Wikipedia before, right? So it is a resource that many people can edit at any point in time. And the people that are editing may or may not know the most current information or be the most reliable sources themselves. So be careful with that. Be careful with blogs as well, because you know blogs are kind of just a form of a diary sometimes. And so while it's good to maybe read some firsthand experiences of some kind of health issue, you know, keep in mind that this is this particular person's experience and might not be true across the board. Okay. Also, we want to check for bias. I just kind of talked about how current the information is. So we'll skip down to the last point and talk about checking for bias. So one of the websites that people like to search is WebMD, right? WebMD, you have all the information at your fingertips, but WebMD sometimes has ads that pop up that are disguised as maybe surveys or information to the thing you're looking up, but is actually, you know, an ad and maybe might lead you to go, you know, look up some particular drug that has paid money to have their ad on WebMD. So you be careful with that. So that's just something to keep in mind. All right, great. So let's talk about how we can find information that's helpful. So let's start with local health resources. And because you guys are here at this virtual program hosted by the wonderful HCPLC, I am a bit biased myself. So let's talk about some resources that our library system can provide you, right? So first and foremost, there are books. You can search our catalog, look for any particular you know, subject or keyword, and we probably have a book on it. The next thing are databases. So let's go to the library website. Give me a moment. And then we'll look at the databases that are available. Alrighty, so on our library homepage, at the top, if you go to learning and research, and then resources A to Z. So we have lots and lots of different databases. If I can scroll, that would be great. So Journal One File, Health and Medicine, Health and Wellness are some pretty good places to start when you're doing health research. Also, there are videos available. And one of the health databases has videos. The Health and Wellness, Gale, they have videos available to you. And if you search books and more, and let's go to ebooks, Hoopla has lots of different videos as well. So you might want to search them in addition to you know, the databases and the videos. Let's talk about websites. So again, at the top, if you go to services, at the very top, there's e-government. The library has put together for you a couple of different helpful websites. So the first one I'm going to point out is Florida Health. Okay, so if you want information directly from your local health department, this'll get it for you. And if you scroll down on the page, there are a cluster of sites that deal with health insurance as well. So if that's something that you need more information about, feel free to look at the Health Insurance Marketplace, Health Choices Florida, Hillsborough Healthcare Program, and Medicaid. All right. So that's the quick overview for our website, HCPLC, that I'm sure you all know very well. All right. Our next slide is talking about general health websites. So we're going to go to each one of these websites. The first one we're going to look at is the CDC. All right. So the Centers for Disease and Control Prevention. So this website is really great because it talks about national health threats, right? So at the very top, of course, coronavirus is up there. But if you scroll down, here we have different outbreaks that are currently happening. And if you want more information, you click on that. And then there are different reports, and you can get deeper on the CDC. But at the top, if you click on diseases and conditions, there are just some really kind of quick go-to things listed, right? ADHD, cancer, heart disease, flu, there's data and statistics, healthy living, food safety, smoking and tobacco use, vaccines, immunizations, obviously are really popular right now. Traveler's health. So if you're, going to travel around, here's something to take note of as well. And each one of these websites has a nice little search box to show you kind of what pops up. So the results, you've got cancer, HPV, statistics, and we've got some different video results. Okay, so there's your overview of the CDC. All right, next, let's look at Community Health Library. This Community Health Library is actually based in Orlando, but they have some fantastic resources. Okay. If you contact the librarian here, and here's their information, they will actually assist you in searching for things. Okay, so if you kind of want a one-on-one personal touch, shoot them an email and they will assist you. At the top of this particular page, you have the Ask a Librarian, so they kind of do like a chat with you online as well if you'd like. They also have health topics, which is what I wanted to highlight. So again, just like the CDC, they have some things listed here on the side. What I really like is that underneath the topic, they have some really helpful, reliable websites listed underneath that you can click on and go and find more detailed information, which is really nice. So this is a great place to start your search for a number of things, as you can see. All right. And last but not least, they did have a recommended health websites link, which are some of the websites that we're going to talk about here, but some different ones: familydoctor.org, healthchildren.org, different kinds of lab tests, clinical trials, so all kinds of stuff, right? Again, a good place to start, general information right here. And while I'm talking about all of this, we do have a handout in the program where I've kind of outlined all of this stuff that I'm going over. So if I'm moving too fast or you miss something, feel free to download the handout whenever you get a chance. All right, so the next thing we're going to look at is Medline Plus. Typing too fast. All right, so Medline Plus has some reliable medical info. It's published by the National Library of Medicine, and it's easily translated into Spanish. So you see the Espanol link. If you just click on it, it'll move everything right on over, which is really nice. So on the left-hand side, there's a trend with information being on the left-hand side, as you guys have probably seen. But we got health topics, drugs and supplements, genetics, medical tests, the medical encyclopedia, and healthy recipes. And we have videos and tools at the top. So again, if you want like just kind of some visual material, that's there for you. Let's click on health topics. So you can see kind of how they've broken everything up. On the first page, you've got your body locations and symptoms. So, maybe you're trying to find out why your nose is running, Let's click on ear, nose, and throat. And it gives us a breakdown of that particular system, right? So some disorders. Balance problem, common cold, cough, dizziness, ear infections, nasal cancer, nose injuries and disorders. Is your nose running because you got hit in the nose? Possibly. Hay fever? Maybe. But again, just information you can click, you can read, and kind of poke around and start figuring things out. Maybe you just have allergies. Completely possible as well. All right. There are even some tests and some treatments and therapies featured as well. Okay. All right, so this is on every subject. So as you can see, Medline Plus is definitely deeper than the other websites that we looked at, or should I say a little bit more specific than the community health page that we were just looking at, okay? Great, next let's go to the Medical Library Association. Now, there isn't like a huge area for the consumer, but when you're on their website, there is a link at the top that says for patients. If you click on it, here's what I really liked about this. In addition to just having health information, you know, in the front that a lot of people are looking for at the moment, on the left-hand side again, there is a what did my doctor say link. This outlines all of the ectomy or, you know, if you have something that's benign, well, what does benign mean? It means not cancer. So, and it gives it to you in really, in layman's terms. So any kind of medical word, buffalo hump, huh, I never knew that. Any kind of medical term where you have a question about it, they pretty much have it listed here. So if you see some kind of results or something and you're just like, I don't know what this word means, this has prefixes and as you can see, all other kinds of medical terms, and it gives it to you in pretty simple language to understand. What's this one? Okay. But anyway, see, it is very extensive, and it's in alphabetical order. So, you know, feel free to use it. But I thought this was really nice and comprehensive, especially if you're looking at things on a piece of paper and you're trying to read it and figure out what it's talking about. They also have top health websites as well. So again, we talked about Medline Plus, we talked about the CDC, top cancer websites, diabetes, rare diseases, and then there are caregiver things, okay? So that's the overview of that one. So like I said, not a whole lot of information, but it is helpful. Also, when you're on here, you can actually find information for local librarians. Oh, here we are. Okay, at the bottom. Great. Find a librarian to help you. You can click on this link. And again, these medical librarians are here to help. They're here to assist you in researching or at least point you in the right direction, okay? So on the right-hand side, you can limit your search to your state, your city, your county, and find the medical librarians in your particular area that can assist you in your health literacy search, okay? And last but not least, all right, so the NIH, National Institutes of Health, they provide information on national medical research, okay? So if you are if you do have cancer, this is the website where you will find the latest, you know, any kind of clinical trials on trying to find cures or anything like that will be listed here. They have a general health information kind of page as well. I also like the fact that they have wellness toolkits. You know, in 2020 especially, you know, we started focusing kind of more on mental health and things that you could do to kind of not get stuck in your head so much. So this page provides you different ways to kind of, you know, be healthier, be well mentally. I thought that was nice. All right, so those are all of the websites in general. Okay, so again, we looked at the CDC, we looked at the Clifford E. Greasy Community Health Library, Medline Plus, Medical Library Association, and the NIH, the National Institutes of Health. So this brings us to the end of the program. I'm going to turn my camera on. I'm going to ask Ms. Tanisha to turn her camera on as well. And then hopefully, if we have any questions, we can go ahead and answer those.
Yes, so remember, you can submit your questions. It's in the questions section, desktop or laptop, questions section of the control panel. If you're on a tablet, it is the question icon, the question mark. Also, if you would like to download that handout that Teresa mentioned earlier, it is available on the handout section. If you're on a desktop or a laptop, if you're on a tablet, just tap on that little people icon and you can access it there. So we do have a question. We have somebody asking, why is the information provided via the library website more reliable than anything else you would find on the internet?
Ooh, because the library is awesome. I'm sorry, that was an opinionated response. Because at the library, we, you know, do our due diligence to make sure that the information that we always provide to the public is factual, and it is timely, and the people that are providing it know what they're talking about. So, and I just know that from working there. So I know that anytime that we have to present a program, like even when I was presenting this program, there are lots of checks and balances before we even push it out to the public. So yeah, the people that work at the library are usually highly educated individuals and know what they're doing. So I trust them. I don't know. I hope that answers your question.
No, Teresa, you're absolutely correct. So all the information that we have to use has to be vetted. Like it has to be, it comes from reliable sources. So everything that we compile, we've checked for all of the things that Teresa mentioned, the bias, making sure that there is done by professionals. So that's why this information is reliable, because we do the checks and balances to make sure that it is. We also have somebody else asking, how can I use, you know, how can I convince people around me that this information is legit, like that this is good information to use?
Right. Well, I think I would probably start by asking them what information are they looking at and who's creating it. Because I think when you start looking at who's giving you the information, like the source, and you understand, you know, what the motive of the source is, then it kind of becomes reliable information, you know? So like the source, the information that you're getting, what is the source gaining from you receiving that information? Like, you know, kind of what is the agenda? These sites that I've showed you, their agenda is just to help keep you educated and make sure that you're the healthiest you can be, in all honesty. So there's nothing that there's no angle, there's no nothing. They're providing facts from, you know, studies. Again, which one was that? The CDC looks at national health threats. So they're looking at information that's coming through, you know, hospitals and stuff, trying to figure out, okay, why are so many people dying from this one thing? You know, so they're trying to help people live. And then the other one, National Institutes of Health, they're focused on medical research. So they're trying to get information out to people like, hey, this is what we're researching. These are the results. Here's how you can, you know, not be negatively impacted by this health thing, you know? So I think that would probably be the best way, is just to kind of, you know, ask them what sources they're looking at and what is the agenda of their sources versus this information where these sources have nothing to gain from giving you this information.
Absolutely. That's really, really good advice. And it's always good to remember that social media is not always reliable.
Check your sources. Check
your sources.
Yeah.
Absolutely. So with that, it looks like we are good in the question section. So I'm going to go ahead and close this out. So if you need to contact us for any reason, there is our contact information there. You can reach us by phone, text, email, chat, however you like to reach us. Also, if you'd like to submit your library story, we're always, especially during this time of summer reading, if you have anything you would like to say about how the library has impacted you, we would love to hear your story. And if you'd like to see any of our other upcoming classes and events, remember, we are right in the middle of summer reading. So if you'd like to check those out, those are available too. Teresa, thank you so much for all of this great information. I know that I learned a lot. Thank you so much for putting this together.
Thank you guys so much for coming, and thanks for bearing with the technical issues.
It happens. You know, we do what we can. All right, everybody, you have a wonderful evening, and we'll see you next time.
Take care. Bye.